Hello, everyone. My name is Diana, and I'm an APCC. And we're bringing today to you our presentation called Beyond Athletics, focused specifically for student athletes. And it's an introduction to the mental health services. And I have here with me my colleague.
Hi, everybody. My name is Katie, and I'm a PCCI, and I'm really excited to introduce our mental health services to you all.
Yes, and we're going to go ahead and continue to another slide where we're going to share a little bit more information about ourselves. So we're going to start out with me. So my name is Diana, and I'm a bilingual associate clinical counselor here at San Diego City College. I work primarily for the Puente program, which focuses on assisting students who are coming into college as their first year and are wanting to, eventually transfer to four-year universities. So my goal really is to support them in anything mental health related. I also work with the Dreamer Resource Center, and I create workshops for them to assist their students in diverse mental health topics. My specific work with athletes in the past has been in Mexico, Chihuahua. I work with long distance runners, and I help them incorporate different forms of mindfulness into their sport. So I'm really excited to be here and be a part of this collaboration and just contribute in any way possible.
Hello, everyone. Again, my name is Katie, and I'm a PCCI, which is a professional clinical counselor intern. I've been an intern at City starting in the summer, and I'm excited to be working with y'all. So I was a competitive rower for about 8 years. I went from being at the bottom to the team to competing at a world rowing championship and winning various awards. So I've been all around the athletic field. I'm super involved in athletics on campuses, which is what brings me here to you guys today. I have experience going from the slowest to the team to the fastest of the team to one of the shyest people to team captain. So I'm very aware of kind of the ranges that you can be within an athletic team. So very understanding, been a part of this world for a very long time. So I'm excited to relate and understand everything that you guys come to us with. I've also experienced issues with like mental health, eating habits, not to mention a whole pandemic while competing. So I witnessed firsthand how intense sports can be and how it can affect people's well-being. So I'm here to help you guys as much as I possibly can during your athletic career and beyond. So I'm excited to be working with y'all.
Thank you, Katie. Now we're going to go ahead and get started and talk a little bit about community guidelines and an overview of what we're going to cover together. So community guidelines are essentially a few key points that we make a part of our presentation, right? It's the way we're going to conduct ourselves during these presentations. And those key points are that this is a confidential space. So we aim to make this space as safe as possible for all of us to share. And we hope that we can all come to the agreement that we keep what we discuss in these, workshops as private as possible. We also ask that we speak from I statements so that we are sharing our own perspective and our own opinion. We also want to mention that whatever is a priority to you is what's most important to us. You come first. So if there's anything that you want to focus in these workshops, let us know. Another component is call in versus call out. There may be times during our workshops where maybe we don't necessarily agree with everyone or share the same perspective. So we ask that, we call in others to get their perspectives and get an understanding of their viewpoints. And we also just want to encourage you to let us know if there's anything else that we can add to these community guidelines, because these workshops are for you. So we want to personalize them. So if there's anything, place it in the chat, let us know, or talk amongst each other. And then a little bit about the overview. So today we're hoping to really introduce you to our services. So we're going to talk a little bit about what the Mental Health Center offers, what the Student Health Clinic offers. And just to let you know, we are together. We are a combined space, but we offer separate services. So we'll run through those. We'll talk a little bit about why this collaboration and provide you with some psych education on current things such as athletics and COVID, athletics and identity processing, athletics and burnout. And we're hoping to eventually have a discussion with you all about how can we improve our mental health? How can we take care of ourselves? And finish off with some resources on how to get in contact with us or get in contact with, any other resources in San Diego County. So we'll run through those.
But first, we're going to go ahead and start with an icebreaker, just something to lighten up the mood. So a fun question that we thought would be great to ask y'all is, what is an unpopular food opinion you may have? I know for me, my unpopular food opinion is that I don't like chocolate. So I don't eat chocolate whatsoever. I know everybody thinks I'm crazy for it. So that's one of mine.
Yeah. Yes, we encourage you to, go ahead and take some time to answer this question with one another. So if you want to pause the video to share with each other, and then we'll go ahead and move on. Thank you so much to everyone who shared and interacted with one another in our icebreaker. Now we're going to go ahead and start talking a little bit about our services. So Katie.
So who is the Student Health Center? The Student Health Center is basically an integrated health center available to City College student. So it's combined with the health center and also our mental health clinic. Both of us work together, like Deanna mentioned earlier. So it's your first stop for all non-emergency physical and mental health needs. We're of service to you. So if you ever need to come in, whether that's emergency related or not, we're open to you for that. And we're formally located on campus in A180, but we're also operating virtually. So if you're not on campus, you don't have access to the campus, we want to make sure that we're still able to help you. So we do have service that are 100% remote. So if you're comfortable with that, we have those services for you as well. Our services are free for students and it's covered by the student health fee. So not having to worry about paying a ridiculous amount for our services, trying to make it as accessible as possible for y'all. And our services are confidential. They don't need to go on your record, so there's no need to worry about pressure. If everybody's going to know your information, for example, we're not going to share any of your information with like your coaches or your other teammates, so no need to worry about that. As well as requesting an appointment is super easy, but we'll get into a little bit more about that a little bit later.
Okay.
So we're going to go ahead and go into our mental health services. So the Student Health Center offers culturally sensitive teletherapy for individuals. You can come by yourself. Let's say you're part of a couple. We are accepting of all versions of couples. So go ahead and seek out our services if you need help with that as well as families. So we really like to get the fact over that we are open to pretty much anybody who attends San Diego City. We're welcome to all. And you can also meet with the counselor over video to discuss mental health concerns and or to just connect with supportive community resources. And to get started with that, you can go ahead and call 619-388-3055, or you can visit us at sdcity.edu/students/services/mental health. And our services are available in multiple languages. It's free, it's secure, it's effective. So just some things to get you familiar with what we offer.
Thank you. Now I'm going to talk a little bit about our student health clinic services. So as I mentioned, we are combined. So in our student health side, we do have nurses, registered nurses on staff, nurse practitioners, and we also have a physician. Currently, they're offering telephone consults as well as telemedicine appointments. What that means is you would call the number that we have here on the screen and talk to one of these professionals and get advice about different medical related issues or information. We're also offering information about COVID-19 updates and vaccines. And within the student health side, they really focus on also connecting you to community resources. So if you're looking for care outside, they can go ahead and provide that. There is also certain services that can be done over the phone, such as providing you with prescriptions, maybe an order for some lab work, x-rays, TB testing, and all of that. So I encourage you to call the number that we have here, or also just visit the website to gain more information. And some frequently asked questions about our services. Do I need insurance? You absolutely do not need insurance. This is something that is included when you're enrolled as a student, so it's paid as a student fee. So there's no insurance required for our specific services. The Student Health Center, and more specifically, our mental health side, focuses on a short-term model to try to maybe minimize the amount of students we serve. So we don't really look at the, how many sessions you'll get. It's really just based on what your needs are. And what do we mean when we say confidential? We mean that we have a legal and ethical obligation to keep all of your information private and secure. So we want you to know this is a safe space. Of course, there is limitations, right, in regards to risk, but all of that is always reviewed with you prior to our services. And then how to get started. So the easiest way really is to go to our website and click on it, and you'll see how to make an appointment, or, how to connect with us through our email. So that's our biggest connection, the website.
Okay, so now that we've gone over the logistics about our mental health center, let's just get to why we're doing this collaboration. So this collaboration is made by student athletes for student athletes, and we decided to do this collaboration just to let y'all know that you're more than an athlete. We're here to provide you with safe, comfortable environments to explore your identity, whether that's exploring your student athlete identity, your identity outside of that, whatever it may be. That's kind of why we're here. And also there isn't, I'm sure as you guys know, there isn't much support offered. I mean, sports psychology is a smaller yet growing field, but I feel like in terms of athletics, you're kind of just told to push past whatever is burdening you. You have a sport to play, you're here to play the sport, just focus on the sport. But I'm sure we've all experienced at different times there, you can't focus on your sport because you have other things that are going on. So we're here to provide you with the support to be able to talk about those things and make sure that you feel safe and comfortable in doing so. So part of the reason is to combat stigma. Like I said before, there's a huge stigma around mental health and athletics, which is slowly but surely getting better. But there is definitely still a stigma. A lot of people think that if you were to seek out counseling, there's something wrong with you, that you're weak, that you're crazy, which is not true. So we're here to combat that stigma and let you know that you seeking out services does not mean that you're less than or that you're inferior, whether that's personally or in regards to your sport. So just making sure that we're highlighting the fact that we're trying to combat a stigma here, as well as just building coping skills. Being a student athlete is extremely hard, it's extremely challenging. There's a lot of things that come with it that a lot of people don't understand and that they don't know. So building coping skills to make sure that you are able to deal with those issues that may come up, and you have the tools to be able to deal with them adaptively and not necessarily doing things that are against your own well-being. And there is a huge correlation between athletics and mental health, which a lot of people may not know. The fact that you are either waking up early or just having long night practices. Practices can be a few hours, and then on top of that, you're going to school, and then on top of that, you could be a mom, a brother, a sister, so many things. There's a lot of stress that comes with that. So it definitely can take a toll on your mental health. So we just wanted to highlight the fact that there is definitely a strong relationship between athletics and mental health. So we're here to highlight that for y'all. Like I said, there's a high level of stressors, whether that's practice, class, personal factors, trying to make it to the pro leagues, etc. So we're here to validate those feelings for y'all and let you know that it's okay if you're having these stressors or if you're having these feelings, and we want to talk about them with y'all. Another factor for this collaboration is an identity shift. I'm sure that a lot of people went through maybe an identity crisis when COVID hit, maybe not knowing if you're going to play your sport, or if it was the last year of you playing your sport, your last year could have been cut short. There's a lot of different pieces that come with the identity of being a student athlete. So we wanted to highlight that aspect as well. Also going into unexpected circumstances. Like I said, COVID, a really big one. I know I was in my senior year when COVID hit. I thought that I was going to graduate. finish with my sport, go off, and it'll be totally fine. It'll be a nice round ending to everything that happened. But there were unexpected circumstances where I wasn't able to do that. And I know a lot of people had a lot of plans for their future, and COVID kind of messed that up. So there are some unexpected circumstances that come with that. Maybe, let's say, a pregnancy. Maybe you weren't expecting a pregnancy, so then that may affect your sport. So a lot of people will do a lot of different things. So we just want to make sure that we talk about those things with y'all. As well as lastly, sport requires mental and physical endurance. And with this mental and physical endurance, that can lead to symptoms such as anxiety, sadness, lack of emotional regulation. So as you can see, why this collaboration, there's a great need. You guys go through a lot and we're aware of that. So we're here to try to help y'all through it as best as we can. So going into COVID, with COVID, everybody was affected one way or another. But I know that a really big thing is that since student athletes have a lot of time spent towards their sport, with not being able to participate in their sport normally, there was an increased time of availability. There's a lot of time on our hands when everything was shut down, when there was a whole lockdown. So that time, increased time of availability can definitely lead to potentially leading to more processing of unpleasant thoughts or emotions. Maybe you weren't a fan of your sport, maybe you're experiencing burnout, and this time off allowed you to realize that. So I mean, that's a really big thing to have to deal with as well. With a lot of time, there's also a lot of time to think. So we wanted to highlight that, as well as an increase in possibly an anxiety, fear regarding whether you continue to play your sport based on COVID. I know a lot of people had to kind of get around COVID in terms of going back to their sport. So there's a lot of anxiety or fear whether you continue because of maybe your COVID results. Maybe you got COVID and that kind of sets you back a little bit, and that leads to being an accountable teammate. So there was a lot of pressure definitely regarding COVID if you were continuing with your sport. I know another big thing that I was aware of is there was a lot of moral or ethical conflict about whether or not to return to the sport. A lot of schools returned on campus for their sports, and I know a lot of athletes felt a bit selfish for coming back because they came back to play to their sports. Meanwhile, a lot of other students weren't allowed to come back to campus at all, or people weren't allowed to go to work, but you had the privilege to be able to continue your sport. So there can be a lot of moral or ethical conflict when you continue your sport through COVID. So I know that was a really big thing, as well as conflicting views between the athletic requirements and your own personal or familial or societal values regarding quarantine. People were asked to not leave their house unless it was completely mandatory. So there could have been a lot of conflict regarding, well, I left my house to go play my sport. Is that really mandatory? So there was a very big ethical and moral conflict regarding that. So we just wanted to highlight that, as well as athletic burnout and identity processing. Like I mentioned before, it's very common for athletes to burn out. You spend so much time and effort on the sport, and it could lead to exhaustion. Maybe you're not as interested as you once were. There's a lot of factors that come into it. So that's another big thing that we wanted to highlight as well. Maybe you could be questioning if the sport is really for you. Is COVID a sign that I should be focusing on something else, or that I have the time to explore new avenues of meaning? If there's any other identities you may resonate with more than your athletics. So there was a lot that was going on definitely during this time, either during COVID or outside of COVID, whether you're experiencing burnout or just questioning your identity as a student athlete. So these are a lot of big factors that have come up, and we just wanted to bring those to your attention, that it's 100% normal if you're experiencing that. And if so, we're definitely here to validate those feelings and to help you through it.
Yeah, thank you so much for that, Katie. We're going to move on to a discussion, and I'm going to cover the first question, and then Katie's going to cover the other two. So we just want to get your thoughts on the information that Katie just provided. You know, do you resonate with any of the points we shared regarding COVID, athlete burnout, identity processing? And I'll let her run through the other two. And please take a moment to pause this video and have this open discussion with one another, and keeping in mind those community guidelines.
And our next question that we have here are there any is there anything that came up to you that you would like to share? I know within the athlete community, talking about these things is not very common. So we could have said something that may have brought up a question for you, or maybe brought up a thought for you that you would like to share. So we'd like to ask this question and give you the chance to do so.
Mhm.
And then our last question is just if there's any question or comments about anything that we just mentioned, if there were any terms or any concepts maybe that you had more questions about, just wanted to get a little bit more insight about, or just maybe like a general not understanding of anything that we mentioned, this is just the opportunity to ask any further questions or make any comments about anything that we have mentioned so far.
Thank you so much, everyone who shared. We're going to move on to the next part of our discussion, which is to hear some of the things that you do to improve your mental health. A lot of the things that we can do are self-care. So there are things that we ourselves can participate in. And we have a little picture here that Katie added, which I think is really neat. It has examples like slow down, keep calm, be positive, take it easy, breathe, unplug, relax. So keeping in mind this image and just anything else that really comes to your head, can you discuss amongst each other, what are some things that you do to improve your mental health? So feel free to have that open discussion, whether it's verbally or via chat, and then we'll return to our next section. Thank you so much to everyone who shared. So the next portion of our discussion is, what are some ways that you can engage in self-care? So we would like for you all to discuss amongst each other, what are some things that you do, whether that's, for example, meditation, maybe watching your favorite show on Netflix, or going on a walk, or just meeting your basic needs, like getting, your sleep in, drinking water, things of that sort. So we want to ask if you can pause the video for a moment and just discuss amongst each other.
And just a few tips when Diana was asking, what are some things you do to improve your mental health? If you were having issues coming up with anything, we compiled a list that are some ways you can improve your mental health. Some include recognizing early warning signs, keeping a routine, even in quarantine. I know that may be hard, but keeping a routine, staying connected to your loved ones, making time for exercise that you enjoy, possibly limiting caffeine, alcohol, coming to the student health center with questions or concerns. There's some meditation and mindfulness apps that are out there, practicing self-compassion. So if you're having issues coming up with anything, those are some examples. Taking deep breaths is a really great thing, and utilizing some professional and emergency resources if you need to. So in case you were having issues coming up with any ideas of how to improve your mental health, those are a few that we came up with together.
Thank you.
Yeah.
Okay, so moving on, Katie's going to go ahead and cover a quote that we brought for you all.
So a quote that we found reads, "Vulnerability sounds like truth and feels like courage. Truth and courage aren't always comfortable, but they're never weakness." And we found that this was a really great quote to bring up because, like we mentioned before, there's a huge stigma around mental health and athletics. And people think that being vulnerable is being soft, or it's being weak, or it's being kind of inferior. But we found this quote to really emphasize the fact that vulnerability sounds like truth and it feels like courage. Vulnerability is telling your own truth. Vulnerability is telling what resonates with you and what you've been feeling, what you've been thinking. And when you are vulnerable with someone, it's courageous. It's something that a lot of people aren't necessarily able to do. So we want to highlight that being vulnerable can feel like courage. As well as truth and courage aren't always comfortable. Sometimes it's hard to be vulnerable and express those things to others, but they're never a weakness. If anything, it's a strength to be able to do so. And we hope that everybody is able to strengthen that ability to be truthful with themselves and to be vulnerable and to have that courage. So I know my coach always would say, you need to be comfortable with being uncomfortable. Being uncomfortable is a very common thing for a lot of people. So just because it may not feel right or feel super comfortable in the moment doesn't necessarily mean that it's a bad thing. It's part of change. It's part of growth. So we just want to really emphasize this quote for y'all as well. And we hope that this means something for you or that it brings up stuff for you as well.
Yeah, take a moment too if you want to discuss or, place anything in the chat as you're doing this activity.
And lastly, we just want to thank you guys for watching and attending this meeting. We really appreciate it. We hope that you got something out of it. So we kind of just went over the basics of mental health and a little bit more specifically mentioning COVID, athlete burnout. But just so you guys know, some upcoming events that we have for the groups and workshops. On October 7th, we have positive psychology and mindfulness, which is something that Deanna is really passionate about and is very informative about. And I think that she and I together can provide you with a lot of information about positive psychology and mindfulness, as well as on October 28th, we have improving our relationship with food. I know it's very common with student athletes to maybe have an unhealthy relationship with food or maybe have like kind of an indifferent relationship with food. So we want to open up that conversation for y'all to just improve our relationship with food as a whole, regardless of where you're starting with that relationship. We want to just work towards improvement. As well as on December 2nd, we have VAR, which is Validate, Appreciate, Refer training. So we have that available for you as well, which is just a process, like it says, validate, appreciate, and refer, that we'll go more in depth about, which would be another great tool and resource for y'all to learn.
Yes, thank you for that. And then I want to mention just before we go, some emergency resources that are super important for you all to have. So the main one, and you can just plug this on your phone or write it down because, maybe you need it or maybe someone that may need it. So it's always good to have. So the first one is, make sure you are, you have the 911 or can dial 911 if somebody, is in an emergency situation, whether that's, they're feeling like harming themselves or harming others, that would be a good number to call. You can always ask to be connected with a PERT team member, which is a psychiatric emergency response team member. So that means that they are trained, in certain aspects within the field of psychology. So they're really well suited to assist individuals who are, going through a mental health crisis. We also have the Access and Crisis line on here. I say use this number if you're needing support, if you're needing to find resources, or if you are in a crisis. It is a service provided by the County of San Diego. It's 24/7. It is confidential and it is conducted by licensed professionals. So the number that we have here is the 1-888-724-7240. You can also text the word courage to 741-741. That's if you're more comfortable with texting. It is 100% free and it is confidential. So it's not going to appear on your phone bill. And you can also contact a support number in Mexico. So if you reside in Tijuana, we do have the call 075, which is a line of support. It's also 24/7 and it's free for anyone that is, residing in Tijuana. And then we also have the Center for Community Solutions here as a resource. It is a crisis center for individuals that are dealing with any form of sexual or domestic violence trauma. So it is, as I mentioned, confidential 24/7. We have the phone number right here as well, which is 858-272-5777. So we recommend that you write these down, put them on your phone, or just have them somewhere where you can reach them. They're great resources in case of an emergency. And then also follow us on social media. So we are really present on Instagram, on Facebook. So feel free to look at these links and follow us. At SDCD Student Health. You can also find the Student Health Clinic and then SDCD Mental Health. You can also follow Active Minds, which is a great chapter that works with us in our clinic. So follow them or our TikTok at City Mental Health. So you'll find information on there on how to make appointments, what workshops we're having, just anything that's going on in our center. So feel free to follow us. And if you have any questions left, anything about, all of the information that we covered, feel free to join us at the Campus Ready, which happens every Monday and Thursday mornings from 9 a.m. to 11 a.m. Also Tuesdays and Wednesday afternoons from 3 to 5. So this is the Zoom ID. All you got to do is plug in this Zoom ID and put in the passcode. And some of our staff members will already be there in that meeting, and you can go ahead and ask any questions. But that's essentially all that we have. I, on my part, just want to say thank you for, joining our presentation, and we're really excited for future presentations. And Katie, I don't know if you want to say.
Yeah, just that. Thank you guys for joining us. We are really excited to bring these series of workshops to y'all to help the student athlete population. So we're super excited to provide all of our services and information to y'all. So thanks for joining. Hopefully we see y'all again soon.